everyone, I'm Carla Macias, host of Best Docs Network featuring Forest Park Medical Center, your destination to better health. Forest Park is a physician-owned hospital that is now open in San Antonio. This hospital is also known to having some of the very best doctors in your area. Now let's start off today's show by introducing one of these Forest Park physicians, urologist Dr. Michael White.
So Richard came to me with a rather common problem that a lot of older men face, and that's just simple enlargement of the prostate. And so there's a certain subtype of men whose prostates grow much more rapidly than others. And that can lead to things such as bladder infections, stones in the bladder, blood in the urine, and then the worst case scenario, which is inability to urinate and possibly damage to the kidneys. Richard came in, he couldn't urinate.
Being 63 years old, I had not had anything to do with a prostate exam since the age of 43, so it was a 20-year span. And so definitely I was avoiding the exams that I should have been having.
And in his case, it was a difficult situation because his prostate was about 8 times the size of normal.
And he frankly told me that yours is the largest I have ever seen.
And when prostates are very, very large, the traditional treatment, which is to typically carve out the prostate from the inside, was not possible because his prostate gland was just too big. So Richard's specific treatment options would have been a catheter for life that he would change every month, to self-catheterize himself 3 times a day for the rest of his life, to have an open simple prostatectomy, which involves a rather large incision from his belly button all the way down to his pubic bone, or to have 5 small incisions and then use a robot to perform the same procedure as the open procedure, but with a lot less morbidity, shorter hospital stay, and less blood loss.
He said, I'm going to try do it robotically, but if I have any problems, we're going to have to do open. And so then I went ahead and said, Dr. White, I have all the faith and confidence in you. You do whatever it is that you have to do.
So Richard was actually the first person in South Texas to have a robotic simple prostatectomy. Richard's recovery has been fantastic. He is urinating without difficulty. He's urinating better than he has in many, many years, and he's extremely happy, and he healed quite fast. He was only in the hospital 2 days.
The recovery has been tremendous. I couldn't imagine going another week, another day in the situation that I was in. The quality of life is 100% better.
Weather today. It is absolutely gorgeous. We have the chamber here to do our ribbon cutting with us. We also have the Dallas Cowboy cheerleaders here, Rowdy's here as well. Just a lot of activity and press as we kick off this facility in San Antonio.
Well, we're so happy to be here, opening our 4th Forest Park facility and introducing the wonderful service that we like to provide to the city of San Antonio. I can't describe how proud I am of what we've been able to accomplish with all of our physician investors all over the state who have faith in what we have talked to them about and have faith in what we're trying to do.
The whole premise behind Forest Park is we're going to do surgery differently than everyone else. We're going to treat patients differently. We're going to have outcomes that reflect a higher quality of care. When we look at robotics, what Da Vinci provides is the ability to, with a minimally invasive fashion, to go in and operate on a patient. So instead of making a large incision in a patient, we're able to do it through small incisions that are placed throughout the patient's abdomen. So if I have a smaller incision, I can have maybe less post-operative pain or less blood loss throughout the surgery. It's much more accommodating to know that at the end of the day, I didn't leave with a large scar. I didn't leave with the associated pain and post-operative complications of having that.
We are always so excited to be a part of these openings, and this is probably one of the best ribbon cuttings that we've ever been to with the chamber. This is awesome. The facility is gorgeous, and everybody should come out and have a chance to take a look at this, because They should be very, very proud of what's in their community.
We're really excited to be a part of this. This is our 5th development for Forest Park so far. It's really a special day for us to be able to invite everybody into our house, to show them all of the work that we've been putting in place over the last year and a half, to show them all of the finishes, all of the art, all of the furniture, to tour them through. They can really get excited about it now and see the reality of those renderings that they saw years ago. Now they're resurrected into what they can walk through and touch today.
We are so excited about opening day. We are ready to go. We've been positioning and preparing this facility for over 2.5 years. And with our over 100 physician partners and over 450 credentialing physicians here, the sky's the limit. We are so excited to raise the level of care in San Antonio.
Danielle has a question for Dr. Holk. Who is a good candidate for a neck lift?
A good candidate for a neck lift is the patient who has realistic expectations. A patient who's had a very full neck their entire life and suddenly wants to have a very sharp 90-degree neck may not be able to get that. It's the position of certain bones within the neck that will dictate how sharp of an angle of the neck that you have.
experience, and that's what they will remember. It's the Disney of healthcare.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine, Forest Park Medical Center. The staff over at Forest Park Medical Center has a reputation of being some of the best of the best. Now up next, we're going to meet one of these staff members, the Director of Perioperative Services.
One of the things that attracted me to Forest Park was the level of commitment, not only with the leadership, but also the commitment from the physician partners. They want the highest level of quality for their patients. They also want an aesthetically pleasing environment for their patients as well. We are going to have great teams where everyone is actively involved in all the decisions that are made in the department. Not only the employees, but the surgeons and the anesthesiologists have also been very actively engaged in helping us make decisions on policy and how we're going to run the department, so it's very exciting. Our operating room is by far going to be the best in the city because of the equipment that we have, because of the caliber of staff and their expertise. The physicians that we have partnered with are all exceptional. The relationship that the OR staff have with the surgeons and the anesthesiologists is much closer than most would expect. They've become more of family to us. One of the things that excites me about this project is we get to start off with a brand new culture and set expectations for exceptional care and pride and commitment to the organization. Instead of going into a culture that's already been established, we all get to kind of take part in creating it ourselves. And it's very exciting for me as a leader, and I think that it's going to be very exciting for the staff also.
Having a scheduled time for eating is a great way to keep your digestive system healthy. Try to sit down for breakfast, lunch, dinner, and snack at the same time each day. Family medicine is devoted to the comprehensive health care for people of all ages. Dr. Soloman Paley is a family physician here in the San Antonio area. Now let's meet the doctor.
One of the things that I believe in is continuity of care and comprehensive family medicine. So the more that the family doctor can manage for the patient care, the better. That way there's more extensive knowledge of the patient's medical conditions, especially if they're hospitalized or having surgical procedures. If the family doctor is involved with their procedures and their hospitalizations, it usually shortens the stays, the outcomes are improved, and it's more satisfactory for the patient as well.
All of our body has some fat, but when the liver has more than 6 to 10% of fat, this is what we call fatty liver, and this is too much. Fatty liver is usually discovered by accident because patients normally don't have any symptoms. So when the doctor detects elevated liver enzymes, he may do a workup to find out why the patient has elevated liver enzymes. Fatty liver is more common on patients who have insulin resistance, patients who are overweight, or patients who have diabetes. It is also more common on patients who drink alcohol. It can also have some hereditary factors. If your doctor detects elevated liver enzymes, he may want to run some tests to make sure that you don't have uncontrolled diabetes, high triglycerides, or other diseases like hepatitis C that may also cause elevated liver enzymes. He may also run some tests like an ultrasound of the liver, and he may do an MRI elastography to find out if your liver has the common fatty liver called NF-ALD, or if it has the more severe cause of elevated liver enzymes called NASH. In this case, what happens is the liver enzymes are going to be high, but patients tend to have severe inflammation of the liver that can progress to liver cirrhosis and eventually to liver cancer. So it is very important to differentiate between the two causes. So what things can you do if you have fatty liver? One of the things is to exercise, to lose weight, and by all means, avoid alcohol. If you have high triglycerides or high cholesterol, make sure that you control those and make sure to control your diabetes also. If the condition progresses, make sure that you see a liver specialist, as you may be a candidate for research or for a liver transplant.
Select Art I started about 28 years ago. It's a private gallery, and I specialize in providing art for public spaces, and primarily doing hospitals and MOBs. And over the 28 years, I've probably installed over 100,000 pieces of art. This is my love and passion in life. My overall goal for Forest Park is to make each space unique and come up with new art concepts for each facility. So what I do is generally I start several months ahead of time once I know a facility is coming about. The art should support the design of a space, very similar to if a man buys a nice suit, then his shirt and tie should support his suit, and a lady's handbag, jewelry, and shoes should support the dress that she selects. So art's kind of like that. It really needs to coordinate and support the design of the space, yet each piece is an individual piece of art. The art for Forest Park San Antonio, I had a brand new sculptor. The folks from San Antonio were the first to see his work, and they actually selected one of his freestanding pieces of sculpture for their facility. It's a really cool kind of a teal blue steel torso of a body on a pedestal in this really unique kind of teal blue color, and that's going to be a featured piece in San Antonio. One of my artists does this hand-blown glass with a metallic finish, and they were the first facility to really have this, metallic blown glass. San Antonio got a number of new pieces that I hadn't shown before. Each facility seems to get better, and even though we think the last one we did was the best one, the next one we do seems to get even better. It's exciting for all of us to put a great art program together. And, and the day of the installation is when it all comes together. And so we get it all there and we get it placed and installed, and then it's like magic. Everything all comes together and it's like, wow, this is great, and people are excited and they're lit up, and we get compliments, the day we install it from the employees that are around, and, it's a win for everybody. So, yeah, we all just keep moving forward.
You notice something about Forest Park Medical Center the moment you walk through the front door. Gone are the smells, the sights, and the sounds that are typically associated with most hospitals. And in their place is something decidedly different. You see, Forest Park Medical Center was designed to be comfortable, inviting, even calming. Fact is, many of our patients don't want to leave. Come experience for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
By heading over to bestdocsnetwork.com, there you can search through all the different specialties a part of this group. You can also watch hundreds of other educational videos. Now, one of those doctors you can find on our website is plastic surgeon Dr. Stephen Pisano. Now let's tune in as Dr. Pisano discusses the gap flap reconstruction.
This is the second time for me to have breast cancer. So the diagnosis wasn't totally surprising. Since they already done the deep flap, then we had to look at what was the alternative. And so the alternative was to do the gluteal flap. I chose an immediate reconstruction because it just made sense to, while you're in there doing the surgery of the mastectomy, why not go ahead and do the reconstructive at the same time? I have a wonderful oncologist who, when it came time to say, what do we do about surgery, I asked her and she immediately said, you need to go to PRMA.
Here at PRMA, we are able to perform a wide variety of tissue transplant reconstruction techniques and options. We're certainly known for the DIEP flap, or the deep flap, as we say. However, we frequently bring into play other tissue reconstruction options. So in particular, the gluteal flap. The gluteal flap can be taken from the upper buttock or flank area, which we call the superior gluteal flap, or it can be taken from the lower gluteal area, we call the inferior. So it's S-gap and I-gap. Most commonly, I would perform the S-gap operation, the upper gluteal area. Even in a thin person, there's typically enough tissue that can give us some good volume for a breast reconstruction.
Today I feel good. I let things be in the past and look forward. I'm very pleased with the results of the procedure. It's a natural looking breast. It feels natural. I met with Dr. Pisano afterwards, and he actually commented that it was the best results that he had seen through the gluteal flap. The PRMA staff have been really good to work with. The consultation with Dr. Pisano, he answered all my questions. The whole experience with that group has been very positive for me.
Many of our patients are coming to our practice because the routine options are not available. So we in the practice are expert at bringing into play a variety of other areas of the body to give us tissue to do the reconstruction.
The church that we happen to go to has a relationship with a girls' orphanage in a small town in Honduras. The orphanage is run under an American lady. The name of the project is called Project Talitha Cumi. And it's basically a girls' home where they house 30 girls who were either abandoned or abused or orphaned. They were having some problems getting vaccinations for the girls in the girls' home. And so we received a phone call asking us to come down and assist in vaccinating the girls at the girls' home. We had to go through a lot of different and interesting challenges in order to be able to go down there. First of all, we had to get permission to practice medicine in a place that had never had an outside doctor come to it. We were able to overcome that challenge, and then the next challenge was actually receiving the immunizations that we could provide to the children. We asked several different pharmaceutical companies. We requested assistance from many of the hospitals that we work with, and we came up initially empty. We then came to Forest Park and asked them if they would be able to help us get the vaccinations to take to the small girls' home in Honduras. And thankfully, Forest Park came through. They gave us, free of charge, the vaccinations to cover every one of the girls that lived in the girls' home. The older teenage girls from the home actually came to the clinic and helped work. They functioned as medical assistants for us as well as translators. And so they were helping clean the rooms, they were helping prepare the vaccines. It was really a great experience to watch the local people work to serve their neighbors. And because they were working in our clinic, they weren't able to do their daily chores. After the clinic, we actually went back to the girls' home and helped them perform their chores afterwards. We ate their meals with them. We said nightly prayers with them. It was an amazing experience. As a surgeon, I think we have an incredible opportunity to meet and care for people at a time of great need. For me, my whole purpose in life, my dream job, is being a surgeon. I love nothing more than being able to walk through these difficult journeys with people and help them find the happiness on the other side. And so one of the things that I love most is being able to take these little short-term trips to patients and people who have great need, because it's the whole reason why I became a surgeon, and it helps remind me how much I love this job and how much I love the people that come to me.
Stephanie has a question for Dr. Ombaba. What are symptoms of carpal tunnel syndrome?
The symptoms of carpal tunnel are varied. The most common is pain, tingling, numbness, weakness, and when it's very severe, when it's very chronic, you find that you don't have any strength in your hand, you stop dropping things.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center. The doctors over at Forest Park Medical Center make it a priority to keep educating their patients on current health topics. One of those doctors is family physician Dr. Ramon Reyes. Now let's take a look at his Beat Diabetes program.
In the United States, the prevalence of diabetes is around 10% of the population. That means that after age 20, 10% of the people are having diabetes. So that means that around 30 million people in the United States have diabetes. In Central Texas, the numbers are a little bit higher because diabetes and weight issues are related, as you know. And by age 50, what the number is that in San Antonio and in Central Texas, 50% of the population is either diabetic or pre-diabetic. That's an extremely high number.
Our main focus is really to provide the highest quality of care in a very comprehensive and progressive manner to our patients. What we concentrate is on a very integrated and coordinated team approach of physicians, providers, staff. We also have 2 extraordinary certified diabetes educators that are helping us with the diabetes care.
The educator here at Bandera Family Health Center is to provide the best education in a non-judgmental, safe environment. That way we aim for success in the behavioral change lifestyle for the patients regarding meal planning, activity, increasing their activity, and of course, education.
If someone came up to me and asked me who I would recommend for treatment for diabetes, I would recommend Dr. Reyes at the Bandera Health Clinic. I've been coming here for several years now, and I think they're doing a good job, and I'm trying to do exactly what I'm supposed to do.
Here at Bandera Family Healthcare, we have a team of physicians and providers and administrators that specialize in the management of diabetes. So the patient that comes to Bandera Family Healthcare to manage diabetes is managed by the whole team. And I always say the patients don't belong to me, they belong to the team and to the office. So now we have more people helping the patient with diabetes.
Dr. Reyes and the staff are always here if I need them. All I have to do is make a phone call.
Stretching can help boost circulation and digestion. Remember, when stretching, to hold each position for about 25 seconds and to breathe deeply. And that'll wrap up another episode of Best Docs Network featuring Forest Park Medical Center, San Antonio. Now, if you're still curious about this hospital or any of the doctors you've seen on today's show, head to our website, bestdocsnetwork.com. We love hearing from our viewers, so if you have any questions or comments, please feel free to email us at info@bestdocsnetwork.com. So long, everyone, and we'll see you next week.